available. President-elect Barack Obama's economic stimulus package has brought about a discussion specifically on how to reinvent healthcare using information technology. Peter Neupert is corporate vice president of Microsoft Corporation's Health Solutions Group. He has just finished testifying on Capitol Hill about that very subject today. He's joining us live now from Washington, D.C. in a Fox Business exclusive. Good to have you, sir. Thank you for joining us.
Hi, good to be here.
Well, you're out of the headlights there from Capitol Hill. So what was the #1 message that you wanted to impart in your testimony today about modernizing healthcare through IT?
Well, my #1 message was we should really focus on the outcomes, not just on the technology itself. What the health system really needs is to adopt technology in ways to deliver better outcomes, better chronic care management, better hospital effectiveness, and that we don't want to get too focused while we're in a rush to spend the money and to help our systems on technology adoption, but we really want to make sure that we have the leadership focused on encouraging the usage of technology to achieve certain goals like better chronic care management. That was the tenor of the conversation.
I think it's very important to point out that Microsoft has been in a position where it has said, don't pour money at the problem, pour smarts at the problem, and I think that that's very smart. But you also talk about a totally connected, patient-centric system. Here's the potential problem I see with that. Everybody hops on the computer to look at patient records, the residents, the doctors, the nurses, and no one looks at the patient. I talked to 2 separate doctors yesterday, both of whom, one on the West Coast, one on the East Coast, said the electronic medical record might be the death of medicine as it pertains to dealing on a human level with the patient. What did you think about that, and how do you address that issue?
Well, I think that's really important. I think what we need to recognize is we continue to need lots of innovation in what is the right technology to deliver better tools for physicians and better tools for patients. But a lot of care happens actually in the home. If you're a diabetic, you do self-monitoring. If you're a hypertensive, you've got to track your blood pressure.
Sure.
A lot of behaviors about obesity and activity are really important characteristics of the health of the nation. And we need to not only think about how do we enable physicians to better use these electronic tools, which we have to do with user interface and other things, but how do we empower consumers to be smarter users of not only technology but interactions with the health delivery system so that they can be more effective advocates for their own care?
President-elect Barack Obama is sort of pinpointing about $20 billion to modernize health IT and the healthcare system, looking at identifying errors, making improvements, clarifying data, things like that. I think that's great if it's used properly, but how do you make sure that this does not mask, as I bring it back to this, the nuances of whole patient treatment?
Well, I think there are lots of things. In my personal opinion is we really need to count on the patient to be fully informed, shared decision maker, or their advocates, their family. That's the most important thing, and to give them access to information that can help them accomplish that. I also think technology, tools, user interface capabilities can really empower physicians to not be so focused on gathering data so that they can have a perspective, but to give them insight as to what that data means so that they can prevent certain conditions from happening, 10 minutes from now, 20 minutes from now, or 2 hours from now in the hospital setting as well. So it's about how do we enable. We spend so much time talking about how to share the data today. I see real promise in tomorrow's systems about really new environments so that physicians can transform the way they think about the problem, not just how much data can I get on a screen so that I can get this task done right away, which is kind of the challenge in today's system.
Peter, how many doctors do you speak with? I know you used to be the CEO of drugstore.com, and that gives you a certain perspective. You sit on certain medical boards that give you insight into how doctors really think and work. But do you speak to physicians? Because if you just talk to the insurance companies and you just talk to legislators, you might be really missing some real guidance.
No, I think that's really true. And when I set out to build this business for Microsoft 3 years ago, we worked really hard to find some strategic relationships so that we have actual learning laboratories with physicians all the time. I have about 10 physicians on my staff in key positions, both on the development side and in other sides. and we have strategic relationships with hospital systems, health systems in this country and in other countries that help inform us to make sure that we're building software that meets their needs, not just what my computer engineers think might make sense.
Great, because in the end, you've got to look at the patient. Tear yourself away from the computer screen, look at the patient. Peter, please keep us updated on this. We really applaud Microsoft for getting involved at this level.
Thank you, Liz.
Peter Newport is Microsoft Corporation's Health Solutions Group.